If you have two knee replacements at the same time and you're thinking, how do I get up from the floor in case I do fall or I bend down, pick something up, and I don't know what to do, I want you to watch this video. Make sure you watch this video to the end so you'll know how to get up from the floor when you have two knee replacements. Hi, this is Reggie from Result Plus Physical Therapy, and in today's video, I want to answer that question because when I created that video about how do I get up from the floor with the knee replacement, I had questions coming in asking, how do I do that if I have both knees done at the same time? Because it's not uncommon that, especially nowadays, that both your knees will be bad or both knees will be deteriorated when you have some pain. And what happens is, a lot of times the doctors will tell you it's either you do one or two knees at the same time. And if you're not sure which one to go, make sure you refer to one of my other videos, search my channel, because I created a video on how you can decide what is the best for you if you're doing one or two knees at the same time. All right? But in this case, let's say you have both knees done at the same time and you want to be able to get up from the floor. How do you do that? So let's get right into it. So now let's say you're on the floor and you have bilateral knee replacement. You had both knees replaced. How do you get up? It's actually going to be very similar to how you get up with one knee replacement. The main difference is you have to know, you have to pick which one is your stronger leg, because that's the leg that you're going to use to prop yourself up. Now, the biggest concern when you have knee replacements is, can I kneel on that knee? Can I put pressure on that knee? My answer to you will be yes, that is safe to do that. It is safe to do that. Those knee replacements, they're made of titanium nowadays. They're very, very strong. They usually don't break unless you fall down and you have an impact on that leg or a strong twisting movement. But that's because the force that's involved in that kind of a movement or that kind of a situation, this force is very strong. Most of the time, aside from a factory defect, we usually don't see replacements or prostheses that actually breaks. Okay, so pick which knee is your stronger leg. So for example, if mine is I had bilateral knees done, I'm gonna pick what is my stronger leg. In this case, I'll pick the right leg is my stronger leg. Most of the time when you have both knees done, it's not uncommon that one of them will be stronger than the other. And they actually did studies surrounding this. One knee has a better outcome than the other. They cannot explain why. It's the same person, same prostheses. They control everything to be as identical as possible, and they still do not know why one of them actually has more scouring and the other one does not have as much. So it's not uncommon that that happens. Also, you have to put into consideration your dominance, your handedness. When you're right-handed, your right leg will be stronger. When you have more strength and you have more range of motion going into the surgery, the outcome will be better. So if that is your stronger leg, unless that has more deterioration, then that means that that is going to be your stronger leg after the surgery also. But if the circumstance is different, then you can change it. Just pick which one is your stronger leg. In this case, my right leg is my stronger leg. So here's what I'm going to do. Well, first is to get up. It is safe for you to put your weight on your knees, meaning you can actually kneel on them, because that's the easiest way to get up from the floor. So in this case, what I will do is I just turn and then just put the weight there. You can kneel on them, right? And especially later on after you have the surgery, if it's several months later, it's not painful, it's not inflamed anymore. And even if it's a little bit, you have to get up from the floor, so you don't want to stay in that position for too long, but a few seconds, half a minute, you should be fine. If you can go grab on something to help you prop up, that will be the best case scenario. If not, if let's say for example you fell in the middle of your living room, there's nothing to hold on to, so from here what you're going to do is you're going to put your stronger leg in front like this, because this is going to push you up. Okay, so in my case it's my right leg, so I'm going to, so from this position I'm going to just put my right leg forward like this. And then from this position, if I can hold on to something and push myself up, I will do that also. If not, if there's nothing here, you can actually push on that right knee, push on that right leg. It's not gonna break. It's nothing different from you putting all your weight on that leg. It's able to withstand that pressure. It's able to maintain that weight. To support that weight, you should be fine, right? So you can actually push up and then bring yourself up. Of course, there will be some strength involved in doing this. It's harder to do this when your legs are very weak. That's why in the early phase of the rehabilitation, range of motion and strength are our main focus, because we need to get your strength back as soon as possible so you'll be able to carry your own weight, okay? Again, so once you turn and roll get into this position, in this case, so it will be easier to show you. Let's say my left leg, in this example, my left leg is my stronger leg, just so it's closer to the camera. So you can actually prop it like this, all right? And then you can push up, going up like this. So this will be carrying doing most of the work, carrying most of your weight, and then you can use your hands to actually help you prop up also if you don't have anything else to hold on to pull yourself up. All right, now that you know how to do that, this requires a little bit of practice. So make sure that you have somebody next to you, or you have something that you can hold on to, or you can pull yourself up on, so that you'll be able to get up from the floor more easily. But it requires a little bit of practice so that when the time comes, you'll be able to do this safely and you'll be able to do this more easily. Thank you very much for your time. Thank you very much for watching this video. Please share this with someone you love so that it can help them in case they do end up on the floor and they had bilateral knees done, so that they know what to do. And don't forget to subscribe and turn on your notification so that you can get alerted, because we release new videos every week. Thank you very much again for your time, and I appreciate you.